Today on Substance Stories, we're going to be giving harm reduction advice around opioid use. Today on Substance Stories, we're going to be continuing our series on harm reduction advice. Remember, harm reduction advice is how to use drugs safely, minimize the harms we get from use. The best way to reduce harms from drugs is to not use them at all. And today we are going to be talking about opioids. So there is some really easy safety stuff with opioids, and we've got to think about it in two ways. We've got to think about how we're using it and what we're using. So we think about how we're using it. You can either smoke it, and if you are smoking it, the tinfoil can be actually quite nasty. You know, risk of getting an adulterant from tinfoil, so I don't recommend that. Or you can eat it or snort it, or you can inject it. Now, if you're injecting it, again, also really at risk of bloodborne viruses, skin infections around there, around the site, which can lead to septicemia, or nasty infections lead to losing arms and legs. And where you inject it matters. You know, if you're going to inject it into the cubital fossa, that's the back of the elbow there, you're at real risk of hitting a nerve bundle and losing the ability to move your fingers for the rest of your life. So it's much better to use a vein that doesn't have a major nerve running alongside it, like on the back of the arm or on the brachial vein over the bicep. That's a much safer place to do it. It means you can play the piano for the rest of your life. Make sure you're using sterile equipment. There are needle syringe programs everywhere. Now it comes to what we're injecting. Well, opioids are potent respiratory depressants, right? So it's easy to get on the nod and have an overdose and die. And I think people really underestimate what an overdose is. If you get on the nod and you're feeling sleepy and your respiratory rate drops, a doctor would probably call that an overdose. And even though you might not think you're at serious harm, you can have small sort of hypoxic events that cause tiny little hypoxic brain injuries, which do build up over time. So it is really important that when you're using with someone and you both have naloxone on you, which can save a life. You can get naloxone from basically any pharmacy. So please have naloxone. I have naloxone in my car because I work with people that use substances, and I'm very worried about one day coming across someone who's on the nod and needs a bit of help. On that respiratory depression, right? Be careful what you mix your opioids with, because remember, opioids are suppressing our breathing in a certain way and we're getting sleepy from that. If I mix it with something like benzodiazepine or alcohol or any other respiratory depressant, I'm massively increasing my overdose risk. And this is how most people die from overdoses. It's polypharmacy overdoses. It's people on a lot of different substances and they have been unable to monitor what they're taking, and puts us at a huge risk of having a significant overdose. Remember, these are illicit drugs, and so we don't know how pure they are. So if you are getting these drugs, make sure you get them tested, make sure you have a little taste so you can tell how sedating it is. The last thing you want to do is shoot up what you think is, something like heroin, it's fentanyl, and that's the last time you ever have anything because it's putting you to sleep for a long time. So make sure you have a taste before you try it. Make sure you're using it in a safe manner and you know exactly what you're using. Even better would be to get it tested. And lastly, if you haven't used in a while, if it's been a minute, take a minute. The biggest risk we have of overdosing is when we've had a long stay somewhere like a hospital or prison. We've lost our tolerance and we think we have the same level of tolerance. And so we take something that would have used to be, previously would have been fine. It knocks us out completely and we end up dying of an overdose. So really be mindful of your tolerance and be mindful about what you are using and take it slow. Remember, the best way to do this is to not use it all. Go see a doctor if you are using opioids, and please consider getting on opioid agonist therapy like Buprenorphine. It absolutely saves lives and helps you get your life back. Thank you for listening.